year. I want to recognize that this has been another challenging year for everyone as we have dealt with COVID-19 and all of the impacts of that through the year. I know that while we've been optimistic about vaccinations and really being able to open up a little bit more with our low rates of COVID in our community, many of us have been affected by losses of family members and friends, and also just the loss of connection every day with the people that are in all of our different work lives and day lives. And that has been hard. And I think this is a month where I think reflecting on just our last year, but also taking time to rest and recharge as we move into another year in January that is going to be pretty exciting for our overall system. So happy December and happy holidays for whatever holidays you and yours celebrate during this month. Today's community meeting is going to be about the electronic visit verification that is starting for regional center services in January. And I'm pleased to introduce Steve Robinson, our Director of Community Services, who will be presenting on that. And we'll have a few more slides after his presentation and then questions. So right. Steve, I'm gonna share this on the whole screen. Yeah.
Good afternoon, everyone. Happy holidays. And today we'll be presenting on electronic visit verification, what it means, and what it may mean for clients and families who receive certain services from the regional center. Great, thank you. So what is electronic visit verification? Or I'll refer to it as EVV, so I don't have to say electronic visit verification every time. EVV is part of a 21st Century Cures Act, which was enacted in 2016. It was put in place to ensure people are getting the services in their home that they need and that they are entitled to. The 21st Century Cures Act requires that all the states in this country set up an EVV system to verify that services for all Medicaid-funded personal care and home health care services occur. Under the Act, the EVV system has to verify 6 service/data components, and they are the type of service performed, the individual receiving the service, the date of the service, the location of service delivery, individual providing the services, so the staff, and time the service begins and ends. So the new requirements for EVV will not change where and how these services are delivered. All states were supposed to implement EVV for personal care services by January 2020 and home health care services by January 2023. It didn't start in California in January 2020. This is because the state submitted a good faith effort exemption request on October 2nd, 2019 to the Centers for Medicare and Medicaid Services to extend the EVV implementation date for personal care services to January 2021. CMS did approve the request, and so here we are, moving on to January 2021. Next slide, please. All right, so the state of California selected SanData Technologies as the state electronic visit verification vendor. They're going to be providing comprehensive EVV solutions to be in compliance with the 21st Century Cures Act. They'll be providing California with a robust solution that includes the ability to capture data during a visit, data portals that allow providers to view and report on visit activity, and an EVV aggregator to provide California with program oversight and analytics. So what does this mean? Which regional center services and service codes need to comply with EVV and when? So by January 2022, these are going to be personal care services. So that will include respite, supported living services, homemaker services, and personal assistance. And then by January 2023, it's going to include home healthcare services. This will include nursing care, home health agency / aid, speech therapy, occupational therapy, and physical therapy. I do want to point out that speech, occupational, and physical therapy, for those who receive early intervention services, this would be for infants ages 0 through 3. These service codes do not apply to early intervention services, so your speech, occupational, or physical therapist would not need to comply with EVV. So SANdata developed a self-registration portal for our service providers to sign up with, and this is their way of signing up with the state. Vendor providers of personal care services are required to register prior to January 1st, 2022. We, as a regional center, have been sharing all this information with our service providers and have been for a few months now so that they're able to sign up and register prior to January 1st. Vendor providers have the option to use also an alternative EVV system. And if they choose to use this alternative, there is still a way that they can sign into the system so that SANdata and Cal EVV will be able to track. The state needs to be able to track the activity, regardless if the provider uses the state system that was set up or an alternative provider. Vendor providers, upon both arriving and leaving to work with the individual, will need to check in via GPS device. So this could be a mobile device, or they could use the individual's landline if they're meeting the client at home. So client and family corner. So how does this affect individuals? EVV does not change how your services are provided, where you receive your services, or who provides them to you. EVV is required in federal law, and it's been put into place to make sure you are getting the services that you need. I listed a few frequently asked questions. So does EVV apply to services in the self-determination program? The answer is yes. Any regional center services that provides personal care services or home health care services would be covered under the EVV requirement. What measures will be taken to secure privacy and confidentiality of data? That's a question that has come up a lot. And the state will have safeguards in place to ensure individuals' private information will remain confidential and protected. All federal and state requirements around privacy, such as HIPAA, remain intact. And EVV will only verify the 6 data elements that are required by law and that I shared in the beginning on the first slide. Another question, is EVV causing recipients to be homebound? The answer is no. California's approach to EVV will not change how services are provided, nor where services are delivered. So EVV is not going to limit the service provided, constrain on an individual's choice of caregiver, or impede the way care is delivered. For more information about EVV, DDS does have a link on their website that they keep updating. And we've included the link on this presentation if you have more questions. They also have listed more FAQs and continue to update those. So that's the end of the presentation on EVV. We'll take questions if you have them.
Should we, you can either put a question in the chat, or you can raise your hand and we will unmute you if you have a question. Are there any at this point? Okay. What I'll do is I'll move on to the other slides and then we'll close the PowerPoint, and then people can think if they have any other questions that we want to answer for you. Everything here is going to be posted on our website. And if you receive services, you should be able to get some of this information also from a service provider. There is one question. Some families have a provider pick up children at school. Will that still be okay?
And good question. The answer is yes, it will be. I see another question. What is the case manager responsible for? The case manager is not responsible for tracking this data. This is something that the service providers of these services have to comply with.
Okay. I'll move on to the other slides and then we can take some more questions at the end. I see there'll be more. So I just wanted, as we close out the year, to get some updates on COVID-19 in our community. Our cases have been really fairly low. We had 24 cases total reported among people served in the month of September, and the numbers dropped in October and November pretty significantly. We'll see how December and January look, because we certainly expect some rise, especially with people being indoors more often right now, and also with the reports of the Omicron variant. And I'll talk about that a little further in a minute. Vaccination, everyone who has had 6 months since their last Moderna and Pfizer shots is supposed to get a booster. And that third booster is for everyone who meets the criteria for those vaccinations. Today, it sounds like Pfizer is recommended also for 16 and 17-year-olds who got the Pfizer vaccine 6 months ago. With Johnson & Johnson, the recommendation is that people get a booster 2 months after their first shot, and that booster can be any of the vaccines that are available. And right now, everyone ages 5 and up can get Pfizer as a vaccine. So the vaccine availability has gone down to age 5. Sometime in January, we do expect it to really go even lower for infants and toddlers. We don't know how long it'll go at this point, it'll go at this point, but those should be available in January. The Omicron variant, which is a new variant of COVID-19 that has concerned scientists because it's somewhat different in terms of how it looks. It looks like it jumped a few generations of mutating as a virus. And so there continues to be concern about what this will mean. A lot of the most recent reports believe that it is more easily transmitted, but it may not be as impactful in terms of people ending up in the hospital as some other variants. But the major points, and this comes from the Department of Public Health Services in California, are to get vaccinated and to get those boosters as required, and to wear masks and face coverings everywhere that's indoors. And most counties are requiring that indoors regardless of vaccination status. There's been some talk about reducing that in highly vaccinated counties, but probably with the Omicron variant, it won't happen for a little while where masks are reduced indoors in our area. If people feel ill, they should be tested for COVID-19 so they can isolate. And this is the time of year where it's easy to confuse COVID-19 symptoms with a common cold, allergies, or the flu. And anyone who is sick should stay home. And I know lots of us may have worked through a lot of different illnesses, but people need to really stay home if they're sick, regardless of whether it's COVID or something else. It's the best for everyone and for our communities. And then I wanted to just give you an update on a few things that are going on in the overall IDD community, and that we'll be working on a lot in the new year. Service providers are going to see rate increases, and these are tied to a study that was done several years ago. And one of the most important things for our area is the rates are going to be more closely tied to the cost of local regions. So we are a high cost area, and our service providers will have different rates than service providers in lower cost areas. And that is targeted to be implemented in April of 2022. There's a lot of work behind the scenes for both regional centers and providers before that happens. The state is also working on a new performance incentive program for regional centers with new outcome measures that we expect to be started next July. That's sort of tied to a promise to fund case management positions at regional centers to actually meet caseload ratios that are in law. And we expect that funding to come through in July. However, as a regional center, we are thinking about that now and really trying to recruit towards a July 1st hire date for many new case management positions. And the last thing is that social recreation was a service that had been reduced in 2009 and could not be funded except under very limited conditions. And that is now a service that can be funded. And we are about to submit a letter to DDS on how we're going to implement that. And also our plans for implementation are supposed to look at how underserved communities can get access to social recreation. And our policies will reflect some of the new parts of this re-implementation of social recreation. We are hopeful that we will have providers who are interested in providing this service as the restrictions of the pandemic end. So we've been talking to service providers about that as well. So those are all my slides. So I'm going to stop sharing, and I see we still have a few questions, at least one or two in the chat, and people can ask more if they'd like. So Steve, let me, so let's see, Michi put something in there, let's see. Okay.
I see that Eric Stern has another question.
Yeah.
What if provider takes the client home to provide care? Will this be a problem? No, it will not be. The provider just needs to sign in when they start working with the client and when they end working with the client. And they need to provide information on the 6 data points that was shared. So it's not going to change the services that are provided to the client.
I'm going to ask Jairo, who is our interpreter, if the question that is in Spanish can be translated. Let's see. Jairo, are you able to do that? Oh, when will recreational services start? So We are currently able to fund recreational services and some of the non-medical therapies that had previously been prohibited. So if that is a service that you are interested in, you can certainly start to talk to your case manager about that. And we have a policy for social recreation, which allows one to look at first what's in the community in general, and then we can look at what needs to be provided that is specialized related to the developmental disability. I think the problem right now is that there are still not a whole lot of providers of social recreation and some of the supports, because oftentimes a child or an adult served by the regional center will attend a community-based activity or a class or something, and we need to find the support to help people be included in those if they need that. And so some of the more specialized recreation programs that we had before aren't in place anymore. And so that's part of this will be really reintroducing those. And we are, as a requirement by DDS to submit a plan by December 15th, we will be updating our social rec policy with our board in January. And so we will post that, yeah. The only, there's a question about social recreation in camp. And right now, camp has been a service that's been considered out-of-home respite, and that was actually how we had camp even before of camps that were overnight camps prior to the restriction. And so we are looking at our policy as to how that can be adjusted, but social recreation that was local in the community and wasn't overnight kind of out of home services will not count against respite. So yeah. Okay, so we will be training all our case managers on social recreation policies. As I said, the services are not that readily available yet. The pandemic has also slowed down providers' ability to start developing these services. So I ask you for patience. If you want to send me a private message with your child's name, let me know, and we can do a little follow-up on that as well for you. So, other questions? Concerns about EVV? Now if you want to send me an email, you can send it to Michi Toy, who is my assistant. You can also send it to our Write to Us email, write to us at rceb.org. That's also a helpful place to get email. So, okay. Anyone have their hand raised? Because I can also unmute you if you want to ask a question. All righty. Well, we'll wait another few minutes in case people have anything else to ask. But thank you very much for joining us today. And we're certainly open if you have questions about EVV. We have this posted on our website, so you can go to the DDS link. And if you have a provider of any of the services that are under EVV, that please ask them about it and how that's going to be implemented. Each of the workers will have to be part of this who are providing these services, and probably be a slow start to that, but with people learning about the system. But it's pretty common in many service systems across the country by now. So, okay. Well, thank you everyone for joining, and we will definitely have future webinars in the new year, probably starting in January with budget information and then moving on to other issues. So, okay, thank you. Bye-bye.